Welcome back to the channel. Today, we are going to talk about what is arguably the single most guarded secret of postpartum recovery. It is a topic shrouded in so much embarrassment, shame, and silence that millions of women around the world suffer through it entirely alone. You can find 1,000 books on how to decorate a nursery, how to establish a sleep schedule, and how to perfect a breastfeeding latch. But very few people sit you down before you give birth and warn you that for months or even years afterward, you might completely lose the ability to control your own bladder. We are talking about postpartum urinary incontinence. You laugh at a joke, you sneeze, you cough, you try to go for a light jog, or you simply lift your baby's heavy car seat, and suddenly you feel a leak. It might be just a few drops, or it might be a complete loss of control that requires you to constantly wear a pad. If this is happening to you, I need you to hear this immediately. You are not broken, you are not alone, and most importantly, you do not have to just accept this as your new permanent reality. To understand why postpartum incontinence happens, we have to take a very close look at the incredible, hard-working anatomy of your pelvic floor. I want you to imagine the bottom of your pelvis as a bowl. Spanning the entire bottom of this bony bowl is a thick, complex hammock made of muscles, ligaments, and connective tissue. This is your pelvic floor. In a woman's body, this muscular hammock has a massive, critical job. It physically holds up 3 major organs: your bladder, your uterus, and your bowels. Furthermore, the muscles of the pelvic floor wrap directly around the urethra, which is the tube that carries urine out of your bladder, as well as the vagina and the rectum. When these muscles are strong and functioning correctly, they act as a tightly controlled valve. When you jump or sneeze, the pelvic floor naturally and automatically contracts, clamping down on the urethra to prevent urine from escaping. Now, let us talk about the sheer physical trauma that this muscular hammock endures during the journey of motherhood. The damage actually begins long before you ever go into labor. For 9 consecutive months, your pelvic floor has been carrying an ever-increasing, relentless amount of weight. It is holding up a growing baby, the placenta, and liters of amniotic fluid. This is equivalent to carrying a heavy bowling ball on a fragile trampoline all day, every single day. The sustained, downward physical pressure causes the muscles to become overstretched, fatigued, and fundamentally weakened. Furthermore, during pregnancy, your body releases a massive surge of a hormone called relaxin. The entire purpose of relaxin is to loosen your joints and ligaments to allow your pelvis to physically widen for childbirth. But relaxin does not just target the pelvis. It softens the connective tissues of the pelvic floor as well, making that supportive hammock even more vulnerable and less structurally sound. Then comes the actual delivery. If you have a vaginal birth, the muscles of your pelvic floor are stretched to absolutely extreme, almost unfathomable limits to allow the baby's head to pass through the birth canal. These muscles can be stretched up to 3 times their normal length. In many cases, the muscle fibers are strained, bruised, or even physically torn. If you experienced a prolonged pushing phase that lasted for hours, if you had a large baby, if your doctor needed to use forceps or a vacuum extractor to assist the delivery, or if you received an episiotomy, the trauma to those nerves and muscles is significantly compounded. It is vital to note, however, that having a cesarean section does not give you a free pass from pelvic floor dysfunction. While a C-section spares you the acute stretching of a vaginal delivery, your pelvic floor still endured the massive, heavy burden of a 9-month pregnancy. And the abdominal surgery itself can disrupt the core muscles that work directly in tandem with the pelvic floor. When this system is damaged, it generally results in one of 2 primary types of incontinence. The most common type experienced by new mothers is stress urinary incontinence. This happens when the physical pressure inside your abdomen becomes greater than the strength of your pelvic floor muscles. When you laugh, cough, sneeze, jump, or lift something heavy, the pressure pushes down on your bladder. Because your weakened pelvic floor cannot clamp down fast enough or hard enough on the urethra, the pressure forces urine out. The second type is urge incontinence, sometimes referred to as an overactive bladder. This is characterized by a sudden, intense, and overwhelming urge to urinate that hits you entirely out of nowhere, often followed immediately by a leak before you can even make it to a bathroom. This type is frequently caused by microscopic damage to the nerves that connect your bladder to your brain, causing the bladder muscles to spasm unpredictably. Many women actually experience a combination of both, which is known as mixed incontinence. We have to hold immense space for the profound psychological toll that incontinence takes on a mother. It is absolutely devastating to your body image and your self-confidence. Motherhood is already a highly vulnerable transition, and suddenly losing control of a basic bodily function makes you feel infantilized and betrayed by your own anatomy. You might completely stop exercising, avoiding the gym or the running trail out of deep fear that you will leak through through your clothing in public. You might start mapping out the location of every single bathroom before you agree to go to the grocery store or a social event. You might avoid physical intimacy with your partner because you feel deeply unsexy and terrified of leaking during intercourse. It shrinks your world. It forces you into isolation. And because society has treated this condition as a crude joke, affectionately calling it a mommy bladder, women suffer in total silence, assuming that peeing your pants every time you sneeze is just the inevitable price you have to pay for having children. I want to be unequivocally clear about something. Just because postpartum incontinence is incredibly common does not mean it is biologically normal, and it certainly does not mean you have to just live with it for the rest of your life. It is a highly treatable medical condition, a musculoskeletal injury that requires active, targeted rehabilitation, just like a torn ligament in your knee or a dislocated shoulder. So, how do we actually fix this? Let us start with the advice absolutely everyone gives you. Just do your Kegels. For decades, women have been told that squeezing their pelvic floor at a red light is the ultimate cure for incontinence. But here is the massive problem with that advice. Most women are doing Kegels completely wrong, and doing them incorrectly can actually make the incontinence significantly worse. Many women simply bear down or squeeze their glutes and inner thighs, completely missing the pelvic floor. A proper Kegel is not just a squeeze, it is a squeeze and a lift. You have to imagine drawing the muscles up inside your body, holding that contraction, and then, crucially, fully releasing and relaxing the muscle. A muscle that is constantly held tight and never allowed to relax becomes exhausted, shortened, and completely dysfunctional. This brings us to the absolute gold standard of care for postpartum incontinence: pelvic floor physical therapy. If you are leaking urine, you should immediately ask your doctor for a referral to a specialized pelvic floor physical therapist. These are highly trained medical professionals who specifically rehabilitate the muscles of the pelvis. Unlike a standard doctor's visit, a pelvic floor PT will perform a comprehensive internal and external assessment. They will evaluate exactly which muscles are weak, which muscles are overly tight and spasming, and whether you have any scar tissue from tearing or a C-section that is pulling your anatomy out of alignment. They will use biofeedback to show you exactly how to contract and relax the correct muscles. And they will build a highly customized, progressive exercise program to rebuild your core strength from the inside out. They do not just give you a generic pamphlet of Kegels, they actively rebuild the functional foundation of your body. Beyond physical therapy, your daily habits play a massive role in managing and healing incontinence. First, we have to talk about hydration. It sounds incredibly counterintuitive, but when you are leaking urine, the worst thing you can possibly do is stop drinking water. Many women restrict their fluid intake, thinking that less water means less leaking. But when you are dehydrated, your urine becomes highly concentrated, dark, and incredibly acidic. This highly acidic urine severely irritates the lining of your bladder, causing it to spasm, which heavily triggers urge incontinence and makes everything worse. You need to drink plenty of water to keep your urine diluted and calm. However, you should absolutely eliminate known bladder irritants while you are healing. Caffeine, alcohol, artificial sweeteners, and highly acidic foods like citrus and tomatoes can aggressively stimulate the bladder muscle. You also need to become hyper-aware of how you are managing intra-abdominal pressure throughout the day. Chronic constipation is the absolute enemy of a healing pelvic floor. Straining on the toilet places a massive, destructive amount of pressure directly onto the weakened muscles and the bladder. You must prioritize a high-fiber diet, stay heavily hydrated, and use a step stool under your feet when you use the bathroom to properly align your colon and eliminate the need to strain. Furthermore, when you are picking up your baby, lifting a heavy stroller, or getting up from the floor, you need to learn to exhale on the exertion. Holding your breath while you lift creates a pressure cooker inside your abdomen, and that pressure will always find the weakest point to escape, which is currently your pelvic floor. By exhaling forcefully as you lift, you naturally engage your deep core and direct that pressure up and out of your mouth, protecting your bladder. In cases where physical therapy and lifestyle modifications do not fully resolve the incontinence after several months of dedicated effort, there are advanced medical options available. You do not have to give up. Your doctor might recommend a pessary, which is a small, flexible silicone device inserted into the vagina that physically props up and supports the urethra, preventing leaks during high-impact activities. For severe, persistent stress incontinence, there are minimally invasive surgical procedures, such as a urethral sling, which acts as a permanent artificial hammock to support the urethra and restore complete continence. You gave up your body, your nutrients, and your sleep to bring a child into this world. You do not also have to give up your dignity, your ability to run, or your freedom to laugh without fear. Postpartum incontinence is a temporary injury, not a life sentence. Please, Step out of the shadows of embarrassment. Tell your doctor exactly what is happening, advocate fiercely for a pelvic floor physical therapy referral, and begin the journey of reclaiming the strength and the absolute control of your own body. Take a deep breath, do not lose hope, and I will see you in the next video.